Good afternoon, everyone. Thank you for taking the time to view my capstone presentation. Some highlights of my shadow experience with Adam is being able to witness his communication style. Whether Adam is communicating with frontline staff or the executive team, he has a way of communicating effectively that I have never witnessed before. Adam is probably the most effective communicator I have ever seen, and I was extremely grateful to have the opportunity to spend some time with him. His leadership style is servant leadership. He believes in building up his team as opposed to himself, which, in essence, if you have a strong team under you, your team's going to perform outstanding. But Adam is always about people first and building his team from the ground up. Another highlight of my day was exposure to the executive team. I was able to sit in on meetings with the president of the hospital, the chief nursing officer, the chief operating officer, and the controller to talk about some of the challenges that the hospital is currently facing. I found this to be an extremely beneficial part of my shadow experience. The individual that I was able to spend some time with, his name is Adam Sinclair. Now, Adam's experience within Spectrum Health is pretty diverse. He began his career as a supervisor of an urgent care facility in the greater Grand Rapids area. He later became the manager of several urgent care locations in Grand Rapids, having more than 100 direct reports. He currently manages the quality, safety, and experience team at a rural community hospital. That hospital is Spectrum Health Pennock. Pennock is a critical access hospital in an extremely rural area whose primary population are senior citizens or a Medicare population. Adam has his master's in business from Grand Valley State University, and he is married to Michelle and recently had a son in August, and his name is Eli. Now let's talk about the mission of Spectrum Health. Whether you're at Spectrum Health Pennock or you're downtown at Spectrum Health Butterworth, Spectrum Health's mission is the same: to improve health, inspire hope, and save lives. What is Spectrum Health? Spectrum Health is Kent County's largest employer, having more than 30,000 employees and growing. We have more than 3,700 physicians and advanced practice providers. Currently, we are standing at 14 hospitals, 225 ambulatory sites. These include physician practices, urgent care, integrated care campuses, and we've provided more than $30 million in philanthropic support to the communities we serve in the last fiscal year. So some highlights from the SWOT analysis for Spectrum Health. Strengths, locations. As I mentioned, we have 14 hospitals covering the state of Michigan from the northern part to the most southern part, with our recent acquisition of the Lakeland Healthcare System in the St. Joseph area. The services we're able to provide, specialists available. You will not find a healthcare system that has the specialists available that we do, from your primary care physicians all the way to heart transplant surgeons. There is essentially nothing that the system cannot offer. And opportunity for advancement for their staff. I personally have been benefited by this, starting at the bottom floor as a medical assistant, and I'm now working as a quality improvement specialist. Weaknesses: competitive wages compared to other systems in the area. The system recently realize that they're paying their frontline staff significantly lower wages than what our competitors are in the area. They are currently working to correct this by increasing the wages of the medical assistants and the patient access services staff. And this is my personal opinion, there are too many layers of executive leadership. Sometimes getting things done or having decisions made or making changes that are impactful take too much time because there's too many layers of people that you have to go through to be able to get a final decision. Opportunities: leveraging the electronic health care record in all facilities. Spectrum Health Pennock is one of the last hospitals that went live on Epic. Epic is the system's electronic healthcare record. And they don't realize its full capacity. You will have all of the patient's healthcare information, whether it was obtained at Spectrum Health Butterworth, Spectrum Health Ludington, Spectrum Health Pennock, at the touch of your fingers. And I often think sometimes the staff doesn't utilize it to its full capabilities. And another opportunity is to invest in staff. While Spectrum Health is improving in this nature, I think if they spent more time and energy on improving the capabilities of their frontline staff, that would be a benefit to the entire organization. And the largest threat for Spectrum Health is our competitors, Mercy, Metro Health, or University of Michigan Health, and Sparrow Hospital. While we boast having the most facilities and the most specialists, sometimes the care that we provide or in the timely manner that we serve it can be improved, and that's why potential patients seek care at our competitors. How is quality measured? Well, Adam Sinclair, for example, is the manager of the quality, safety, and experience team at Pennock Hospital. So his main focus is to make sure that the quality measurements are taken care of for the hospital. This is done in many different ways. So data analytics. There are certain types of data measures that we have to report to governing bodies and insurance carriers, specifically the Centers for Medicare and Medicaid Services. Our facility is required to be at a certain level in certain care areas, such as sepsis, such as readmissions, and we measure those quality metrics and have to report them annually. We also measure quality by patient satisfaction. Most patients that are seen at a Spectrum Health facility or ambulatory setting receive a patient satisfaction survey. It's highly recommended that those surveys are filled out because that gives us the opportunity to improve the quality of care that we provide to patients. And we also measure quality in the likelihood to recommend. So part of that survey asks the question, how likely are you to recommend this service to a friend or a family member? They take that data specifically very seriously when making decisions about changing the care or changing the processes up to the care that they provide. So one way that the internal communication of the mission is presented is in the form of our new president and CEO. So improve health, inspire hope, and save lives. In 2019, Tina Friesdecker was named the new president and CEO of the Spectrum Health System. This was after a long tenure by our previous president and CEO, Rick Breon. Rick Breon's focus was more on acquisitions, acquiring more hospitals to our system, being the biggest and best in Michigan. And his mission and vision was to become the leader in health by the year 2020. Well, needless to say, Spectrum Health fell a little short of that goal. It's now 2019, and we are not the leader in healthcare. There are other systems nationwide that are outperforming Spectrum Health on a daily basis. So when Tina came in, she decided to change the focus to be patient care. That's why we're here. We're here to provide patient care, inspire hope, and save lives. Tina's first step as the president and CEO was to implement quality, safety, and experience teams within all of the hospitals. Previously, these teams were segregated to pretty much just the Grand Rapids area, and the regional hospitals didn't see much benefit from these teams. Now, every regional hospital has a QSE team located within their facility who is there to provide quality, improve health, provide safety, save lives, and experience to inspire hope to improve the quality of care that we provide our patients on a daily basis. As I mentioned before, Spectrum Health tends to be a little bit leadership heavy. I'm going to focus specifically on the Spectrum Health Pennock Hospital. So Pennock Hospital has a board of directors. They also have a board quality and safety. We have a president and Southwest market leader, a chief operating officer, a chief nursing officer, a controller, departmental physician leaders, departmental managers, and house supervisors. There are many layers of leadership located in just one small regional hospital. This is one area that I do believe Spectrum Health needs to focus on. While we have an overall governing body for the Spectrum Health system, each regional hospital also has a board of directors and a board quality and safety. I believe that all of these boards need to be on the same page and making decisions that are strategically improved for the entire system. Technology is used at Spectrum Health every day and with every patient, most specifically the use of Epic, which is our electronic health record. Spectrum Health uses probably the most advanced electronic health record for every patient interaction, whether they're at their primary care physician's office, they're at the lab having blood drawn, they're having surgery, they're inpatient at the hospital because they're very ill. Any patient that's seen at a Spectrum Health system has their electronic health record available at any time, anywhere. This software is also capable of providing several reports which are used to validate the quality data that we have to provide to the governing bodies and insurance companies. While Spectrum Health is pretty good, there are some improvements that need to be made. Some of the top challenges for Spectrum Health are access to care at our ambulatory offices. There are some specialty physicians or offices that it can take several months to get in to be seen. For example, the ears, nose, and throat office. For a new adult patient to be seen at their practice, patients are waiting anywhere from 4 to 6 months. Patients just can't wait that long to have their health concerns taken care of. In addition to that, I had mentioned previously competitive wages for the frontline staff. Although Spectrum Health is trying to make improvements in these areas, they are hemorrhaging staff to our competitors at an unfortunate rate. We are losing quality, experienced people to our competitors simply because they can make more money someplace else. And last but not least, growing competition. Spectrum Health used to be pretty much the only game in town if you went into Grand Rapids, but that's not true anymore. Mercy Health, Metro Health, University of Michigan Health, and Sparrow. Sparrow's even kind of creeping into the West Michigan area. They are all competition for Spectrum Health. Those are the top challenges that I see for the organization at this time. It's hard to kind of summarize everything that we've learned in the last 4 years, but the top 4 management concepts I feel I've came away from this program with a greater understanding in human resources. In prior roles, I had done a lot of interviews for potential new candidates for the offices that I supervised and completed performance appraisals. This program has given me more tools to probably be a more effective leader in those areas. Communication. While I always thought I was a good communicator, I wasn't necessarily an active listener. Both go hand in hand, and these are areas that I'll be working on going forward. Servant leadership. I think this is extremely important. A little bit of encouragement in building up others goes a long way. And not only is it helpful to them, but it's helpful to me. So I want to become the servant leader that I witnessed Adam being with his staff recently on my shadow. And in addition to that, business ethics. While we all want to believe or feel that we always do the right thing, that's probably not necessarily true. So my understanding of ethics and morals and how it encompasses or how it's encompassed into the business world is something that I took away from this program and will always do the right thing going forward. So here we are at the end of our journey. It's been 4 years of a lot of learning, a lot of stress, but I come away from this program a better person, a better leader, a better woman in my faith in God, and having developed, although virtual relationships, developed these relationships with many of you that I've been in this program with for the last 4 years. I want to thank everyone for this opportunity, and thank everyone at the Cornerstone University organization for giving me the opportunity to learn. I thank you very much, and I hope to see you all at graduation in May. Here are the references that I used for my presentation.